So you're telling me that Waleed is permanently disabled, but the government would say that it's for the greater good?
In effect, yes.
Millions of Canadians are waiting for some sort of medical procedure, a number that keeps growing.
And it took me about a total of 5 years to actually finally get the surgery.
The number across the country is actually 5.8 million Canadians on some kind of a medical wait list.
Many developed countries around the world have universal healthcare systems where everyone is covered. Sweden, Germany, France, Australia, Japan. The list is actually quite long. In those countries, patients can choose, use the public system, or pay for treatment at a private clinic. In Canada, we don't do this. The government requires that patients should only have one option: the government health system. With the exception of Quebec, citizens are generally not allowed to pay for surgery in their own province. Some argue this ban is for the greater good. They believe that you shouldn't have the option of paying for surgery at a private clinic because allowing private surgical clinics to charge patients will hurt the public system. Instead, you may have to suffer in pain or even die while waiting for surgery from the government, but it will be for the greater good. To learn more about this, we started our journey by speaking with Joanna Barron from the Canadian Constitution Foundation. So basically across Canada, we're seeing patients suffering, people that are living with constant crippling pain. Some patients are even dying on waiting lists because the government's not providing care in time. So if you think about it, the government has taken their money in tax dollars. They promised health care. They not only didn't deliver health care, but they're banning alternatives for these patients, aren't they?
Yeah, so in the case of Waleed, who had a progressive spinal curvature, he and his mother were seeking treatment to correct the scoliosis in his spine, and the wait list was so extensive, and the government kept stringing this family along, but it was clear that the nature of this spinal disorder is that it gets worse and worse, and it becomes permanent. And so ultimately, Waleed and his mother sought treatment in the United States, but by that time it was too late, and he's permanently paralyzed.
So he's permanently paralyzed as a result of this greater good notion. I want to ask you about Lauren's case. This is an Ontario patient, Lauren Johnson. In his case, he was facing a pretty brutal battle with cancer. The government basically said, there's nothing we can do to help you. So again, they took his money in tax dollars when it was his turn for health care. They didn't provide it. Thankfully, he ignored what they said. They basically said, you're gonna die. He ignored them. He went to a clinic in Baltimore, paid for surgery, a lot of money, and that clinic, it looks like they may have saved his life. Now, if that clinic tried to expand in Ontario, the government would have said, no, you can't do that, right? Isn't that what they would do? Is they'd say, well, it's part of the greater good?
Yeah, in general, Ontario has provisions, healthcare provisions that prevent private delivery of essential health services, like, for example, cancer treatment. And the rationale does come down to it's to protect the greater good, and it's to prevent doctors from taking any hours within the private system.
How did we get to this point where you're not allowed to spend your own money to improve your health or even save your life in some cases? I decided to ask Dr. Sean Watley, an author and a past president of the Ontario Medical Association, about the history behind Canada's healthcare bans.
So it didn't happen all at once. It happened sort of slowly over time. But in the end of the 1960s, with the Medical Care Act, which is a federal Medical Care Act, the federal government said, we will give you, the provinces, funds, federal funds, if you create single provincial insurance programs that are publicly administered, they're portable, they're comprehensive, they're universally accessible. And we will give you those funds if you put your private insurance businesses out of the business of providing medically necessary care.
So why would they want to take away that choice? I mean, if you think about education, the K-12 system, across Canada, parents can choose between putting their kids in public schools, or some decide they want to do private schools. Why in healthcare would they say, no, you've only got one choice, you have to use the public system? Why would governments do that?
Some people were very strong saying we need a single payer approach. We can't have multiple payers. because those multiple payers are all businesses and they're focused on profit, and the government is more benign and fair and generous and kind, and they're going to cover everybody no matter what. And so that argument won the day.
This ban hasn't gone without legal challenges. A patient and a doctor from Quebec challenged it in court, ultimately ending with the 2005 Supreme Court decision, Shaoli v. Quebec. The court found that access to a waiting list is not access to healthcare, helping to open up choice in Quebec. Dr. Brian Day from British Columbia tried to extend this right to the rest of the country by launching his own legal challenge. During the trial, the BC Court of Appeal acknowledged that patients were suffering on waiting lists, but claimed allowing choice would harm the public system. Dr. Day appealed the decision, ultimately reaching the Supreme Court, but they simply decided not to hear his case. Thus, the Supreme Court has actually created two-tier healthcare. The court awarded healthcare rights to Quebecers that they haven't extended to people in the rest of the country. For decades, union leaders in the healthcare sector have vehemently opposed any kind of private healthcare in Canada. They don't like it when governments pay a private clinic to help patients with something like an MRI scan, cataract surgery, or a blood test. But they also don't like the idea of keeping the public system, but letting patients pay for healthcare at private clinics if the patient wants to. Instead, they want health services delivered in government buildings using unionized staff. Why are there vacancies right now?
Lack of staffing, and that's the bigger part of what we're having with the privatization groups, is they're actually they're cannibalizing staff away from the hospital sector in order to do these private clinics. They just don't magically appear.
So why don't the staff want to stay in the public system?
Well, a lot of them do. They're just trying to make ends meet. That's a whole other conversation about lack of what they should be being paid. But to make ends meet, a lot of people working second jobs, and they pick up these on the weekends, which leads to burnout when they come in during the week for their job through the public sector.
When we have these cases where people are wanting to go outside of the public system, you've said that shouldn't be allowed. Is it that patients shouldn't have choice outside the public system because it's for the greater good? Is that the idea?
Greater good, yes. Yeah. When you start creating a two-tier system and allowing people to jump the skew, then it actually puts more strain on the public sector at that point.
And so, I mean, you mentioned a good example of people waiting to get their cataracts done and the suffering that often happens. People can go blind if they don't get their cataracts treated in time. There's a quality of life issue. If we think about other procedures too, like knees and hips, obviously that can be very detrimental to people living with chronic pain, people even dying while waiting for surgery. To not allow people that option outside of the public system, is that being done for the greater good?
Well, I would say so, because, what's happened in Ontario since they privatized cataracts, so to follow your theory, right? Okay, then things should be looking up. But in fact, the waiting lists for Ontarians measured against where we were before we privatized and where we are now against the performance of the other provinces, we've deteriorated significantly.
Riza DeBeer is a retired professor, previously with the University of Toronto's Institute of Health Policy, Management and Evaluation. In that famous case from British Columbia with Dr. Day, he was trying to challenge the system in BC. The BC Court of Appeal seemed to suggest almost this notion of a greater good, that patients shouldn't have the choice, because if they have the choice, then it could harm the public system. Is that something that you agree with?
Yes.
How do you feel it would harm the public system?
Well, I think it harms the public system if you have a thing where you're making you less likely to get the care that you need, because those are being, the resources are all going into this private thing. So the people who aren't as sick and don't really need the care are getting priority over the people who really do. If you have a certain number of clinicians and you take those clinicians out of the publicly funded system, then they're not available in the publicly funded system.
No one wants to see the public healthcare system lose all its staff because they're working in clinics where people can pay for treatment. So how do better performing public healthcare systems allow choice while avoiding this problem? We asked Crystal Wittevrongle, an independent healthcare expert. Again, we hear this idea that whether it's a private clinic or a nonprofit clinic, that they might take the staff away, maybe recruit them away. And you can see maybe how that might happen. Is there something that could be done to help ensure that the public system does have enough staff?
Absolutely, and that's the beauty of looking to all these international examples, is we can learn from what they are currently doing and having better outcomes. So there's guardrails in place which often limit the amount of time that a professional or a doctor or specialist could spend serving private patients in order to not chip away at their time in the public sector. And all we have to do is really look to some of these other countries and see what they've done. Regulations are there and guardrails are in place.
Nadeem Esmail from the Fraser Institute echoed what Crystal said about other countries allowing choice while having guardrails in place to protect staffing levels in the public system. But he brought up another interesting point.
We have surgeons who are limited in operating time right now in Canada. We have unemployed new graduate surgeons. Physicians ready to practice in the healthcare system, they can't find slots because operating time is so severely restricted. We have nurses who are unable to find effective work in the public scheme that suits their individual circumstances. And so sometimes we've seen nurses from Ontario traveling into the United States for work. We have nurses leaving the profession because they just are frustrated with how it operates. The healthcare system we have now is monopolistic. It's dominated by a single union and dominated by government. It doesn't have the flexibility the private system has. So as we see an increase in private actors, what we'll see is an increase in flexibility and employment arrangements that may well attract back many of these workers.
If we continue on Lauren's example, would he or would he not have had two choices? Wait or hope that the system would treat him, in which case they said no.
Yeah.
Or he'd have to leave, right? There's no option for private cancer treatment.
The other option could have been to find a different doctor, a different hospital that would be willing to do it. Like if you're in, a big city, there'll be multiple hospitals. So if you have one hospital that says, no, I'm sorry, we're not going to take you, another one might be able to. Your family doctor might be able to help you link up.
So I asked Lauren, why didn't you simply go to another hospital? When they told you that, Lauren, was there an option for you to just simply go to another hospital?
There was only other hospital I know of that would do it is in British Columbia, and I know that hospital has the same reputation, maybe even worse than the hospital I went to, for sending people home. And sending people directly to MAID, medical assistance in dying, and just throwing the towel in right off the hop.
I'm guessing you didn't explore this, but if you did want to go to BC, how long a wait? Any idea how long it would take them to?
I know a friend of mine who had the same scenario, actually the same rare cancer as mine. The wait was atrocious. Again, and she was sent home with a reference to MAID. It would have been worse. At least I did get seen. They diagnosed me and said, no, you have too much disease. You're not going to fit our parameters. There's nothing we can do for you.
Alan Phillips has been suffering for years with intense back pain because he can't get the surgery he needs in the public system. We asked him about this notion of the greater good.
So when you tell me people see it as a greater good, tell me what's the greater good. I'm costing you money. For 20 years, you taxpayers have paid for my opioids when all I needed was a fusion, and I'd be back to work, enjoying myself, doing a good job. That builds a country. When people are working and paying their fair share of taxes. I don't know how anybody could say that there's a greater good. There isn't. If you could indicate it to me, the good that is the result of this, please tell me. I have not been able to find any profitability or good in this whatsoever.
One thing that has struck me about talking with people in Canada who don't want patients to have a choice between using the public system or paying privately is that critics aren't familiar with how other countries do it and have a better universal healthcare system. People bring up other countries where they have this choice, countries in Europe especially. How do you think they do it?
I don't know.
We'll have to call them. Why is it that no one seems to have actually moved to the Canadian model? Like no one in Canada seems to be...
No, most countries are very similar to the Canadian model.
But they don't ban people from paying if they don't want to use the public system.
I'm not sure. I mean, this is not my expertise.
In 2019, a professor from Harvard was asked to testify as an expert in front of the Supreme Court of British Columbia. He was asked if Canada was the only country that prohibits private health insurance for hospital and physician services. He said yes.
No one in the world copies Canada.
Why is that?
The short answer might be that we just do such a bad job of providing care, but in the policy world, and if I had my papers in front of you, I could give you quotes, name, author, date, where it's very common for people now to say, whatever we do, we need to make sure that this policy doesn't result in a Canada-like result. We don't want a Canada-like outcome.
Long wait times.
Long wait times, high costs, poor efficiency, poor integration, you name whatever metric you're looking at, people around the world use Canada as a model to not copy. But Canadians aren't aware of that because 96% of us never need to use acute care in any year. So if you look at any population, only about 4% of that population will need to use acute care services in any given year. So most of us live on the dream of Medicare and don't have to experience the reality of it.
Let's talk about across the pond for a second. Sweden, France, many other countries in Europe, it's pretty much standard, isn't it, that you would have both a public system and private or non-government options that you could use as well if you didn't want to use that public system. Is that right?
Exactly. Australia is another really good example. And these are really complementary systems. So in Denmark, for example, if the public system is unable to get you the operation that you need in a certain amount of time, the medically appropriate amount of time, then you can get it in the private sector, which would be publicly paid. So they complement one another as well in ways that we don't see here in Canada.
Riza brought up an interesting point. She's worried that people in private healthcare could take advantage of patients and sell them services they don't need. How? Well, most of us don't know how the human body works and the pros and cons of different options.
So you have these private clinics that say, we'll charge you more money and we won't take you if you're really sick. And we'll try to encourage you to buy a whole lot of things that you may not need, but we'll tell you you need them so we can make a lot more money off you.
This seems like something that could happen. There are around 100,000 doctors in Canada. No doubt you could find some bad apples in that bunch, just like you could any other industry. But in medicine, it's common to get a second opinion. Before paying for a private hip operation, you could ask a surgeon at another clinic if you really need surgery, or if you need the upgraded implant that's available. People do research all the time in other industries before major purchases, like cars, appliances, homes. Some people even check out Google reviews before trying a new restaurant. But Riza's point remains. You'll want to do your homework before choosing a surgical facility. Is it ethical in your mind for the government to say to the public, okay, we're going to charge you high taxes, we're going to promise you health care, in many cases we're not going to give you what we've promised, and oh, by the way, we're also going to ban you from getting what you need in your own province. Is that ethical?
I think when you put it like that, it sounds insane. And I think that young people are really struggling with that combination of things and in asking themselves, do they see a future in this province, in this country, when there's such a limit to what's possible, and healthcare is a perfect example of that.
Canadians are treated inhumanely in the process of receiving medically necessary care in this country, despite what all governments say, and in spite of all these promises, the system is just getting worse year after year because governments are not making the necessary reforms to actually deliver on the promise of a high-quality healthcare system.
Are we actually providing care for 80-year-old widows in North Bay? Are we providing as we promised? If we aren't, then what policy decisions are we making to make sure that those people get care? If the government can't provide it, then the government shouldn't be insisting on being the only provider of that care because they aren't living up to their promises.